Many of our seniors have hip and knee osteoarthritis, but majority of them are confused on the type of exercise that is considered safe for them to do. Can you relate to this? In this video, I will share with you 9 exercises to help manage hip and knee osteoarthritis at the comfort of your own home. This is a conditioning program that you need to do at least 3 times a week for 4 to 6 weeks so that you can see the result and you can feel the difference. Greetings again to everyone. This is again Doc Sherry, Doctor of Physical Therapy. If you're new here in my channel, I would like to personally welcome you to join our growing community where you will receive weekly health videos on a weekend that will benefit our beloved seniors, you, and the people you love. Osteoarthritis remains to be the most common condition affecting the joints of the body, and it is continuously increasing due to an aging population and due to the increasing rates of obesity. If you don't know or if you are not sure if what you have is osteo or rheumatoid arthritis, you can click on this video here to help you manage your condition more appropriately. These exercises will target specific muscles in your hip and your knee joint. It is important because it will promote lubrication in your synovial fluid within your joint capsule that will help with circulation and with healing. It is useful for you also if you are currently complaining of morning stiffness. So over time, what these exercises will do is it will help you move easier and better. These exercises will also strengthen the muscles around your hip and knee joint because you really need to keep those muscles as strong as possible. You should not feel pain while doing these exercises. If you do, please consult your doctor first or your licensed physiotherapist for a thorough personalized evaluation. I would not encourage that you do these exercises as well without their permission if you have gone through knee and hip surgery within the past 4 months. Otherwise, these exercises are safe for you. Are you ready? Let's begin. You need to do these exercises together with me so that you can memorize them until this becomes a reflex on your end. If you have any type of hot compress at home, you can use it in your affected part for 15 to 20 minutes. What it does, it helps increase your range of motion while doing these exercises. First, assume long sitting position. Using a rolled towel, place it under your foot and try to pull the towel towards you. Hold it for 15 seconds and repeat it 2 times. This will help regain knee extension, a movement that is affected if you have knee osteoarthritis. Do it on the opposite leg as well. Using the same towel, pull the towel while bending your knee. Hold it for 10 seconds with your knee flexed and straighten it. Repeat it 10 times and do it on the opposite leg as well. Some of my patients would have pain when the knee is bent. What is good with this exercise is you can control it within your tolerance but at the same time slowly increase your range of knee flexion and extension. The only motion in your knee joint. Next, get a ball. Or using the same rolled towel, put it under your knee. With your ankle dorsiflex like this, press, hold it for 7 seconds and repeat it 10 times. Do it in the opposite leg as well. This is an exercise for the biggest muscle of your thigh.
Transfer the ball. Put it in between your thigh and squeeze it gently. Hold it for 7 seconds and relax. Then repeat it for 10 times. This exercise will also ensure that your kneecap stays in the center of your knee to prevent what we call as lateral patellar tracking, which happens in some patients suffering with knee osteoarthritis. Next, using an ankle weight, we will strengthen the muscle of your hip and knee joint. Tie it around your ankle, bend your knee, and kick up in the air. Do this 10 times and repeat on your opposite leg. We are going to do flexion and extension with the foot flat on the bed like so. Do it 10 times. Repeat on your opposite leg as well. It is important to add weights if we want to strengthen your muscle. Start with a lighter weight and progress slowly. You can start with half kilo and then progress to 1 kilo of ankle weights. This can be easily purchased in sports center or online. The purpose of this is to prevent buckling of your knee, which will lead to fractures and fall. Hold a chair or something that you can hold onto for balance. Place your feet slightly apart and bend your knees in a comfortable range for you. It shouldn't be too deep and it shouldn't be painful. With this exercise, you are using your quads, which helps stabilize your knee joint. In this position, it also targets the biggest muscle of your inferior thigh while also developing your balance. This activates muscles in both your hip and your knee joint. Next, still holding on to a chair, stretch your quadriceps muscles like so. Sit on a chair. Using an ankle weights, raise your legs like so. This is to strengthen your hip flexors, which is needed when you walk, run, and use the stairs. Repeat it 10 times and do it on the opposite leg. Lastly, move your leg sideways like this. This exercise will strengthen your hip abductors or your gluteus medius, which is also limited and becomes weak if you have hip osteoarthritis.
Along with this conditioning program, you can also do walking, cycling, or you can also do stair climbing. Just always be sure that you are safe at all times. If you have rails in your stairs, always be sure to hold it. And as a rule of thumb, I would like to share a secret with you that will ensure your safety and your stability. Always make sure that you put your good foot first or your non-painful side first when you go up the stairs and your painful foot when you go down. To help you remember that, we have a code for it. Good leg goes to heaven and bad leg goes to hell. That means that you put your good foot first when you ascend and then your bad foot first when you descend. This is to ensure your safety and your stability at all times. So for example, if you have pain in your right hip, when you go up the stairs, you use your left foot first, and then when you go down, you use your right foot first. These are our 9 exercises to help you manage hip and knee osteoarthritis at the comfort of your own home. If you find this video helpful, please don't forget to click the like button if you do, to encourage me to do more useful videos like this. If you have friends or family members who are also complaining of hip and knee pain, please help them by sharing this video to them. If you are currently having arthritic pain and you want to know about your alternative of managing pain without taking pain relievers, you can click on this video here. Should you have any questions regarding hip and knee osteoarthritis, please comment down below because I would surely get back on you. Thank you very much for watching. I hope that I was able to help you. This is again Doc Sherry. Stay safe, stay happy and healthy. God bless you.